Okay, thank you, Uli. Thank you, colleagues. I'm a cardiologist. My name is Domenico Cianflone. I'm the co-founder, chief medical officer of Amicomed. None of us is that guy on the boat. Okay, what is Amicomed? Amicomed is the first fully digital platform for blood pressure management, combining innovative monitoring and lifestyle intervention. Also, it's fully automated, is highly personalized, scientifically recognized, and consumer grade. How is that? We're trying to tackle the hypertension problem that you know maybe even more than me, which is a big problem in terms of people involved, the overall expenditure, and the impact that it has on its consequences. And there are plenty of unmet needs in the healthcare system, as Yuli just said, and in hypertension management. One for all is that the majority of hypertensive people are not within target. That means they're not in the situation to reduce their adverse outcomes. To obtain that, there are plenty of gaps in communication, in continuity of care, in patient satisfaction that needs to be addressed. How do we try to answer to those needs? Physicians and then patients. With physicians, we provide an unprecedented data analysis, which is a progressive interpretation of the ever-changing blood pressure values, getting access to physicians to real-life data, and overall a better quality of care because physicians can focus on real priorities. And let me make a common example that most of us have seen when we're presented with a piece of paper, plenty of blood pressure numbers, and we have to grasp if there is anything relevant in those numbers for us to make a clinical decision. Also, last but not least at all, when we face it with an hypertensive person, we used to say, well, you need to eat better and move more. Transforming this little and very short sentence into something actionable, it's lengthy and might require the intervention of several people. Second, the patient needs. Trying to understand, getting to understand what is happening to them. How many of you have seen people worried about this ever-changing number? So providing a quality feedback on the blood pressure trend. Getting the answer of the lifestyle changes that we prescribe to them to follow. And start understanding better through educational tools what blood pressure is, why should they take the measurement, should they take the pills. So a sort of self-empowerment into being part of the care process. How is this? Well, it's a unique and innovative approach because it is based on two proprietary algorithms that we developed. The first one is, you guessed already, the progressive interpretation, and it's the first one, of the blood pressure evolution, understanding whether there are trends or dangerous fluctuations, meaning those kind of fluctuations that increase twofold the risk of stroke. And the first to translate the existing criteria from guidelines, starting from the AHA, American Heart Association, Life Simple 7 criteria, into something which is precise for that individual and actionable on a daily basis. Amicomed is a service, cloud-based. We're not a device, even if devices could be connected. And it's geared for patients and physicians as well. Let's see the first component, remote monitoring, that provides the feedback that I mentioned. And we'll see the detail, and it's fully automated. The algorithm takes care of this progressive interpretation. Let's follow a patient journey. which is our traditional experience of day by day. On the first day, first encounter, we see that patient is hypertensive. We do prescribe the assessment. We start medication. We say to him, okay, let's check in a 3 months' time, for instance, for a follow-up. And we do all know that patients try to behave before the visit, to get to diet the day before the blood sugar test and to take their blood pressure pills in the previous day. So we might have seen a normal condition. And the same could apply after some time. We don't know what happens between this snapshot of a movie that contains surprises. That's how we could change it, and then we'll go to a practical example. The initial setup, the early detection of something going wrong, and the intervention by the physician on the selected patient in which the pattern of recovery of the blood pressure improvement is not there. And also because a personalized lifestyle changes program has been delivered with better outcomes and a better management from the healthcare provider side, addressing people that needs to be addressed and so saving time and resources. Let's go into an example to understand what this first algorithm does. Many patients, we said, are coming with a piece of paper, and some of them are coming with an Excel graph, plotting all the data. And yes, I wanted to be sure that this is the laser. Overall, if this is a month worth of blood pressure measurements, and we see a downward trend for which we could be happy, and we might be inclined to say, okay, these are outliers. Overall, the situation is good. We did our job correctly. But the algorithm is saying something different, either pictorial, there is a thunderstorm, or by plain words, saying, okay, go and check your doctor. And why is this? Blood pressure is going down and we have a warning? Well, since the blood pressure is analyzed in the different components, for instance, during the different parts of the day throughout a month and weeks period of observation, we see in this particular case that the early morning trend is reducing, so, well, we're doing good. In the afternoon is going down. In the evening, we don't see a trend, because we know that if we're going to drive a trend, we have a little glitch, but we can follow in the meantime. If we draw a trend here between, we might be inclined to say, okay, the blood pressure is steady under 40, so no major changes. But this is the kind of guy in which the increased risk of stroke is there. That could mean, in our particular case, that the coverage of the treatment throughout the 24 hours is not enough, so the action to be taken is go BID or a longer acting. This is the first part, the first component. So helping patient understanding pressure by pressure, how it is evolving by clear messages and highlighting the situation in which advice is needed. This happens seamlessly from a website, or better yet, with an app, in which the screens are changing and providing, well, if the things are going well, are good, they are advised. So this is an innovative approach because it's fully automated based on the analysis of the algorithm. Then there is a second section, the lifestyle intervention that we said it's a transformation from the general rules that are in all the guidelines into something actionable. And why is this? To cut a long story short, I can tell you briefly that we take into account into preparing and providing the program all the concomitant conditions, all the lifestyle preferences and limitations that could be on the eating and in the eating behavior and or the capability to do an exercise. Just to give an example of the power, if we in any hospital we call the nutritionist, he comes up with a dozen, 20 different dietary schemes in his pocket. The system provides more than 1,100 different 90 days, 3 meals per day dietary schemes and an uncountable number of combination of an increasing month by month physical activity program for every individual, taking into account strongly all the concomitant conditions. So, is this effective? Does it work? What means to try to change the lifestyle and to take control of the blood pressure? We know very well, since at least 15 years and more from the literature, that a tiny change in the mean blood pressure of a group of patients or the population, few millimeters, would have a greater impact on the number of people in which blood pressure is going to be close to normal, on the overall mortality, and on the savings. Just to give another example, New York State, average 2 millimeter reduction, more than 370 million savings projected by the state health agency. What can we obtain with Amicomed? Well, we have exactly a 5 millimeter reduction of the mean systolic blood pressure, and these are the results of our case control study that was accepted and presented last April at the American College of Cardiology, with a persistence into the program of greater than 70%, and with some people in which the metabolic component was greater, talking to physicians, they understand, greater up to 20 millimeters. We presented the data and selected and presented several scientific sessions starting from the model, the results, and the impact of the new design of the hub, which was developed together with Frog Design recently. We have some use cases that we are putting forward for the implementation here in the United States. Hypertension, as we managed so far, but concomitant condition as well. Take heart failure. People need to stay on a pretty stable range of blood pressure, heart rate, and weight in order for treatment to be effective on the short term to reduce recurrences of readmission and the long term of outcomes. Or with pregnancy and post-pregnancy, both for reducing preeclampsia or reducing the chances of being hypertensive in a stable way. These are our anchor initial customers. With UCSF, we are addressing post-pregnancy. We have a contract with them. We already submitted even a study for funding to the NIH. We are waiting for the reply any week soon. With the Life Physician Group, which is based in New York, Long Island, and Connecticut. It's a group that addresses more than 25,000 obese childs. And the scope is, okay, in the family we need to change the overall behavior. So the Amicomed is prescribed to the parents. Well, you see a famous name in the drug area, a big pharma company, and together with their digital acceleration lab, we are monitoring, addressing the monitoring of this parameter in heart failure. With Weill Cornell through the TIPS initiatives that we, is very large, into adding to the care that physician assistant and nurses give to these patients into monitoring. We are, and it's not listed yet, closing an agreement with the American Heart Association for exactly implementation of the lifestyle. Go-to-market strategy. What we are selling to whom and why. We're selling this solution to enhance blood pressure control, not only in hypertension, but only in the other situation that I mentioned, possibly to care providers involved in value-based model, and they should pay for that in order to gain benefits for achieving the metrics or to save money in the process of the delivery of care. How much should they pay? Well, our estimates for a 3-month program are in the range of 100. 5 minutes, okay, good. And you know very well that if you don't meet the metrics, well, the loss for the entire organization could be huge. We want to go further on. After we moved from Europe to the States last year, and we started Amicomed Inc. in December. We need to start monetization and making the product available, taking advantage of the more sensible digital health environment in the United States this year. In the next year, consolidate and start preparing the expansion wider in the States and abroad, and then further on in the next 5 years. But this is a long story. We need to focus on the short term. Focusing on the short term, which is 2017, we already started a preferred seed funding, for which we closed already the first part. That comes up here. We did the closing just before Christmas. Was a nice present. We're getting the need is 1.3 million, and we finalized the. Can I go back? The relocation, the organization here. We're doing HIPAA compliance, which will be ready in March, and turn on the U.S. operation and start marketing the service in order to get by the end of the year the 3 to 6 letter of interest or contract. This is the team. Here we have the Vice P for Business Development, Mr. Andrea Mason here, and I wish to thank you for listening. Thank you. I don't know if there is a questions section.
Sorry, where did you guys, where were you guys for US market?
In Europe, namely in Italy and Switzerland. Yes. Not yet. Eventually, the power of addressing the identification of strange trends and patterns is powerful, but as you know, as a startup, we need to focus vertically to a certain market. So the focus is there now. We will be happy to partner with someone delivering diabetes and join forces to have a more comprehensive offer to providers and patients. Yes?
Good presentation. I mean, this is you presented the snapshots of blood pressure measurement. How do you get the moves? In other words, how does the patient know the interim status?
Okay.
Get that information?
Yes. The point is that patients can provide to the service their blood pressure measurements, either typing them or through connected devices, which is something people does either because they scribble the numbers on a piece of paper or they use one of the many tens of digital logbook, which eventually do not check for blood pressure which are inverted in numbers or simply impossible. So the feed of this number feeds the algorithm that compares the last measurements to all the other ones and detects comments like saying, okay, your blood pressure today is normal, but is increasing from before. The algorithm has the capability to detect very subtle trends. And this is, for instance, the power we could apply to pregnancy. Because if in the first months, we detect a trend that goes from 110 to 120, we could project easily to 140, 150 before the end of pregnancy, which is already a critical state. There was one there, and then you. Thank you.
How did you calculate the cost?
I'm sorry.
How did you calculate the cost for each, I think it said instance?
It's not an instance, it's a 3-month program. So that was compared to the cost of monitoring, and that's our initial assessment. And then obviously, it depends on the numbers. If anybody is going to buy a phone, it will pay $500-600. It's going to buy 10,000 phones, the price will be different.
So that was the cost, not the price?
It's the price. It's the price for the service. I'm sorry to if I mix up cost and price. It's the price.
Yeah.
Yes, please.
Yeah, I don't know anything about insurance coverage in Europe versus the US. What are you discovering in terms of how you get reimbursed for this kind of services in Europe versus in the US?
Okay, the situation is quite different, as you know, because throughout Europe there are national health services that cover practically 99% of care. But even in that situation, that is an out-of-pocket service that is going to be paying in Europe as well. For the reimbursement code, eventually when we will have enough local numbers with providers, we could address payers and eventually have a reimbursement code like other startups are having in other areas. For instance, for diabetes that they have with Intermountain.
In Europe, do they have this reimbursement code?
It's out of pocket for the moment.
So the $100 is
Yeah, it's compared to it should be compared to the different local state of the economics in the different countries. But that compares.
Okay, last question.
Yeah. How many users do you have?
Currently, we have between 5,500 and 6,000 users in Europe. And just to give an idea, the presentation at the American Society of Hypertension last year was on the distribution of blood pressure values, how many were normal, the distribution of usage of 3,200 people with 70,000 measurements.
So for your analytics, are you using that user base or are you also using some hospital data?
For that result, it was the preliminary, it was our pilot study at the beginning of the service, and I must add that those results were obtained with the initial app before the redesign, and these were unsolicited patients that eventually downloaded the app from the stores and voluntarily subscribed. So this is the model where they did and closed.